is Shane Logan, and the topic that I chose is smoking cessation in hospitalized patients and the effect that smoking cessation education and pharmacological therapy has on patients that are admitted into the hospital. Smoking causes an estimated, there's about 42 million U.S. adults that smoke currently, and about 480,000 people die from smoking each year. According to CDC, smoking increases your risk for COPD, lung cancer, and coronary artery disease. It also increases healthcare expenses, and in the United States, smoking illnesses cost more than $300 billion each year. This topic is important to me because I see the effects of smoking on a daily basis on people who come into the ER. It's important to the public because it increases healthcare costs, and the effects of secondhand smoke has been noted to cause the same health concerns, such as COPD and bronchitis. There's now a lot of laws in place that restrict where people can smoke. Unfortunately, this does not deter people from the habit and has no effect on getting people to quit. For my PICO question, I chose for the population for patients that are in the hospital setting while they're admitted. The intervention is to smoking cessation education and pharmacological therapy compared to no intervention, help them to quit long-term after they are discharged. I did not do a time interval because smoking cessation is a lifelong outcome. This topic has a relevance to nursing because nurses are at the forefront with patients and are the ones with the patients the most while they're in the hospital. They are also the ones giving the discharge instructions, where they're most likely to be given smoking cessation instructions to take home with them. The database searches that I used were the Cochrane database, and my preliminary keywords were smokers, smoking cessation, nicotine, and quit. The topic of smoking cessation during the hospital stay yielded about 3,922 results. After limiters, which were tobacco addiction interventions to help smokers and other tobacco users quit, yielded about 11 results. The rationale for those limiters were because they were the only options for smoking. I also used the ECRI Guidelines Trust. I typed in smoking cessation, which was the most applicable guideline. The ERC guideline actually produced 29 results also, and I found that one more helpful actually because it did have a specific article on my topic. The other database that I used mostly for my 5 articles that I chose were the ProQuest database. I used smoking cessation of patients and long-term, which yielded 20,493 results. I narrowed it down with using full-text English peer-reviewed articles in smoking or adult. After smoking, it came down to 3,223 results, and typed in case studies as well, and that came down to 207 results. After all the filters were in place, it got down to 19 results. The 5 articles that I chose was the first a level 3 quasi-experimental design. This one explored predictors and perceived barriers to the delivery of smoking cessation advice to hospitalized patients by nurses. This was an interesting one because it had one of the barriers was actually the perceived perception of smoking by the nurses themselves, meaning if they smoke, they're not going to really give good advice. The second one was a level 4 well-designed, non-experimental design. This one identified factors associated with smoking cessation in patients, applied to a smoking cessation unit after 2 years of follow-up. The next one was a randomized controlled trial, level 2, that examined the efficacy of intervention for smoking cessation for patients admitted to the hospital after a CABG or MI. The next one was a level 4, well-designed, non-experimental design. This examined smoking behaviors of hospitalized patients and explored factors leading to their abstaining from cigarette use after being hospitalized. And the last one was a level 4, well-designed, non-experimental design. This examined the prevalence and correlates of smoking cessation and pharmacotherapy in hospitalized patients with an acute MI. As far as similarities between those articles, they all looked at smoking cessation of hospitalized patients. They used pharmacological and alternative treatments. They all used a multidisciplinary approach, and smoking cessation education while in the hospital positively impacted all of the patients' decision to quit. The limitations for the studies had some similarities as well. The self-report that may have contributed to bias. The patient's decision to not participate may have skewed results as well. Comorbidities such as psychiatric illnesses or substance abuse may have affected the generalizability of results, and biochemical validation was only conducted in a few of the studies. In conclusion, the evidence from the articles chosen support the recommended guidelines. There's evidence to support the implementation of smoking cessation and education therapy on hospitalized patients while they're in the hospital, as well as follow-up appointments. There's specific guidelines for smoking patients on the website that recommends that clinicians ask all adults who use tobacco use about their tobacco use and advise them to stop using tobacco and provide behavioral interventions and FDA-approved pharmacotherapy for cessation to adults. The patients that undergo an intensive smoking cessation program have been found to be statistically significant higher rate of reported long-term abstinence from smoking as well. And that's the end of my